Derail Life Solutions. I hope everybody is having a great Sunday evening or afternoon, depending on where you're located. Give people a time to come in where I'm kind of just chilling out, enjoying this good Houston air. It's nice and cool. I'm not gonna say cool, but it's a nice little breeze out. It's like 80, low 80s, 85 degrees. Nice breeze outside. So I decided to go live and kind of talk about how religion and mental health overlaps. And so I'm gonna give people a time to kind of chime in, and so I'm gonna have a brief discussion with you all, maybe 30, 45 minutes, in which I will give my own perspective of religion and mental health and how they overlap. Okay, appreciate everybody that's in here right now. Um, Kind of give everybody a little time to come on in. Appreciate those that are coming in right now. We're gonna have this conversation, and I look forward to hearing from people in the comment section, giving me their perspective on how religion and mental health overlaps. This can be a very, very challenging, sensitive, triggering, misleading, and confusing discussion, all mixed into one. And the reason why is because religion has been here before mental health. And for most people who are a part of any religion, they sought mental health. Um, I would say I'm not going to say treatment, but they sought a place where they can manage their mental health through religion. It provided a safe space for those who were experiencing a lot of life stressors. And so religion provided that environment for people who were experiencing depression, for people who were experiencing a mental illness. Before there was a such thing as the DSM, it provided a social environment, a safe place, positiveness, support. Shut out the K business. It provided a place where people could safely and in some ways um, secretly or confidentially to a certain extent deal with issues that affect mental health as it relates to their relationships, marriage. Shout out to Rico Lasso. So religion provided that. And so when people talk about religion and we talk about things that relates to mental health, it can be very sensitive because people who in my opinion, I don't recommend, but people who depend on their pastors, other clergymen, or religious figures to provide some level of counseling for them. Okay, they are doing that because of their religious belief, not necessarily because of it being scientifically effective. Okay, and there's a difference. Now, I have dealt with this issue throughout my career as a person who grew up Baptist in the Baptist church in the South, and as a person who has seen the positive and negatives of people seeking pastors and other religious figures for some level of what they conceive as counseling. Okay. Now, as I became more educated in the field of psychology and as I become more educated as a counselor, and particularly as I took the journey of being a therapist in treating people, my perspective became um, more negative towards people who are seeking religious refuge to cope with their mental health. But I would never, and I want you to all to understand this. I will never discourage people from seeking or taking advantage and being welcoming to whatever religion, church, belief, or religious organization who's there to try to help them. However, I would never recommend and I would never encourage anyone to seek a religious figure for services that are outside of their training, even if they are trained or in their, as far as whatever religious education that they have undergone. And the reason is because religious figures, although they can use, there is a such thing as Christian counseling. However, there is a legit Christian counseling degree. There's an MA in Christian counseling, and then there's also legit professional organizations and certifications and licensure for Christian counseling. Okay, there's a difference. There is a difference. They overlap because people go to the church, people go to religious figures, religious organizations to help them deal with life issues. No different than someone seeking a therapist who will teach you structured, scientifically proven, research proof. Now, although it's not a cure, but therapeutic work and techniques, we're bound by a licensure or professional organization that monitors us and makes sure that we're competent. And if we do anything outside of that, there could be um, consequences for that. You will not get that at a religious organization. You go to a religious organization, a pastor, clergyman, religious figure, bishop, whatever title they want to give you. And if they make you sicker or if they cause harm to you mentally, um, there is nothing you can do pretty much about that. There's no consequences. There's no reprimand. There is no board that you can contact and say because under the disguise of religious organization, they have the ability to not be held accountable for causing damages. I can. If I did something to cause harm to you, I have what's called professional liability insurance for my facility or myself. I have my board to be accountable to, or any professional organization that I am in line to. That's a difference. And so there's an overlap because, particularly in the black community, but not just in the black community, all communities across the board have a level of skepticism as it involves seeking mental health or professional counseling. In the black community, I dealt with that for years. It's getting better, but as I see now, 20 years ago, it was a huge problem for me in developing my practice because a lot of black people that I was marketing to did not want therapy because they felt that the stigma of I am crazy. When you go to a religious organization, you don't feel that you're crazy. You feel like this organization loves me, they care for me, they're Christian like, they're going to help me, they're bound and guided through the grace of God. They're going to bring the similar values that I have. I can in many ways relate to you. I can bond with you. We have commonality as it relates to our religious beliefs. So you're not going to do anything to harm me as opposed to a person that I don't know that has these degrees on the wall, okay, who has his licensure on the wall, who has all kinds of certifications and training. I have no idea, how this may affect me long term. Unfortunately, guys, unfortunately, I'm going to say this unfortunately, in the latter half of my career, as the African American community, and not only that, other minority communities, because I find this more often in minority communities in which they seek the refuge of the church for mental health treatment or mental health relief, and they decide to use a therapist as a last resort or after they encounter a negative situation with their particular religion, okay, or organization or whatever belief system they're involved in. And so I have seen an increase in that over the last 10 to 15 years. Early in my career, people would tell me, "Oh, I don't need therapy. I give it up to God." And they will use all types of religious sayings that are not in the Bible. However, these are things that they were conditioned and programmed to think as it relates to their faith in God. And I'm in no way in any position to go against or debate you on your religious beliefs. Matter of fact, in the counseling relationship, because I have people who do seek therapy with me, and it's because of religious issues. Many of those religious issues is not necessarily as it relates to the Bible and other religious foundations and rules and things as far as how you view sin and how they view their life as it relates to the Bible, but more or less the relationships that they find compromising and stressful, adverse in the church or religious setting. Many of them are people who would come here say they had issues with their pastor. They had relationships with their pastors. They had sinful relationships. They engaged in, let's say, uh, behaviors that were not conducive to a positive Christian environment with the pastor or deacons, deaconess, etc., etc. I have had situations in which people went to, and this is what I found the most, is that many of the clients that I would have that sought the services of the church first, that sought the pastor as a quote unquote counselor, Christian counselor, because that word uh, has a lot of connotations to it that is misinterpreted. And let's be honest, guys, there is a space and there is a need for Christian counseling. And I would not discourage anybody to seek Christian counseling. However, as a therapist and as a person that knows the field, uh, I encourage anyone who is seeking Christian counseling to seek Christian counseling from a person that has a master's degree in counseling and who is certified in mental and in Christian counseling, or a therapist or certified clinician who has years of treating people through religious issues. I would not, and I'm gonna say this, a chaplain or whatever you want to call them, the father. Again, not to say that these people cannot provide positive support that in long term can and will affect you in a positive way and put you in the right direction from a spiritual perspective. But the bottom line is that these people are not trained in other variables that may be contributing to your issues. And in many of these situations, people who are having long-term chronic issues, these people are in a lot of precarious situations that are affected due to mental health issues, psychiatric diagnoses. Okay, that these people are not trained and have no experience in understanding, even through psychoeducation and through clinical treatment and training. They are not built to treat that. This is outside of the Christian or religious realm. Okay. And so um I'm saying this, guys, because that there is a necessity for people to educate those who seek, who seek these type of services, okay, and they have a negative outcome. And that's my experience. And then I have people who claim that, hey, they went to their pastor and that pastor helped them through things, and they had positive outcomes. They helped them spiritually and so on. And so I've talked about that with clients as it relates to the limitations of a religious figure providing some level of what you perceive as counseling. And so a pastor who, in my opinion, is doing the right thing is going to operate within the confines of the religion and not necessarily in the confines of what is conceived as professional counseling. Okay? Telling you what to do to solve a problem is not counseling, but helping you identify the risk, the positive, the negatives, the potential outcomes, alternative strategies, how it affects and how you can cope in whatever outcomes that occur in a strategic therapeutic manner is professional counseling. Okay? And so I don't make decisions for my clients. A professional counselor does not make decisions. A professional counselor does not tell you what to do and what not to do. A professional counselor provides an environment in which he or she assists you in understanding what could and could not happen and how you can respond to it in such a way that is for your benefit. There is a difference, okay, guys? There is a difference. And unfortunately, and I'm gonna be honest, guys, as a person who grew up Baptist, I have sought consultation from professional therapists before, and I've also sought spiritual uh, relief and sought consultations from religious figures in the past, as a child and as an adult. I have people in my family who are religious figures. I come from a very religious family, particularly on my dad's side of the family. I have several very reputable uh, adults, and I would say people who were um, influential in my spiritual journey, and they helped me in seeing things in a certain perspective at that age, at that maturity level. But none of those particular people ever attempted to provide what people would conceive as counseling. Okay. They are there to provide some level of guidance, some level of perspective, some level of spiritual growth, some level of positively affecting you and leading you through a spiritual journey through those issues. Okay? There is a difference. And I'm going to be honest, what led me to discourage the black community and other minority communities is the fact that, again, my experience in my practice and the fact of the irreparable damage that was done. I'm talking marriages ending. Okay. I'm talking about financial exploitation. I'm talking about psychological abuse. I'm talking about cult like environments that one could experience in these organizations that affect people chronically, long term. Okay. And again, as I have stated, and as I will repeat, I would never discourage anyone to seek any type of emotional support from a religious organization. I would never do that because I have sought emotional support throughout my life, and I will continue to support. I there's nothing wrong with having a powerful church home that will be there for you to support you, okay, to help guide you, to help you in whatever ways is needed, to be there for you, to have accessibility to people who have and who are following the Bible in such a way. Okay. And as far as all religious tenets, okay, I've even, man, listen, I have talked to people of all types of religions. I've talked to people who were Muslim, NOI, black Muslims particularly. I have talked to people who were Methodist. I've talked to people who were Episcopalian, Presbyterian, Catholic Church. I've talked to all types of religious religious figures and so on. non-denominational. And you know what? I've had more positive um, experiences than negative. I've only had a few negative situations where people kind of got out of bounds on some things, and you run into the risk of people trying to tell you how to think, what you should believe and what you should not believe. And so, as a professional therapist, it is unethical for me to to influence my values, my morals upon my particular client. And so a competent therapist would not do that. However, when you are involved with a religious organization, that may be a bulk of what some may attempt to do or not. Okay, because it's a belief system. So at the forefront of the belief system is to focus on what you believe, how you believe, when you should pray, when you should not pray, and following an interpretation of the King James Bible. Okay, that is highly what you're going to get. Now there are, and I find this, and I have actually recommended some of my clients who were involved in structured um, support groups in church that focused on like parents with bipolar kids or children, or parents who are dealing with autism. Particularly, they could have church groups where they have prayer service for those that have relationship and marital issues. Those who have suffered physical, sexual trauma, domestic violence support, and things of that sort. I recommend, well, depending on the situation, I would have to review what they're doing. But in many situations, um, I encourage people to have that positive interaction. I'm not going to discourage people from doing that. Now, what I will discourage, if this person is acting as if they can counsel you and provide a level of therapy or providing something therapeutic for you, that's going to put you in the right path, because that's outside of their expertise, is outside of their training, particularly when they have no training. However, there are churches who do have counseling related programs. And in my ability to recommend that or give my client my clinical impression of whether or not it's good or not, I'm going to review what that program is about. But more or less, I'm going to review the credentials of the person who's facilitating these activities. And if this person is facilitating activities that I would deem somewhat related to being a therapist, and they don't have the proper credentials, I am going to not recommend those types of activities. I would recommend them go somewhere else. There are churches that have substance abuse related programs. I'm gonna be honest. Um, the NOI, the Nation of Islam, has been known, and this has been something I studied in school. The Nation of Islam has successful substance abuse treatment. Now, I'm going to repeat, the Nation of Islam for years has a great reputation of providing an environment to help people clean their lives up from drugs. They have over what 70, 80 years, I would say, of proven uh, what I would say testimonials and outcomes of cleaning black men and black women up from drugs and setting them in a path. Now, the difference between this is that in that you are accepting Islam. And so again, part of that is they want you to convert, or they use the conversion as an avenue for you to reach sobriety and to be clean. And so there's nothing wrong with that in a religious format, because that's what these organizations are there for. However, as a professional therapist, I cannot do that. I cannot, again, that is imposing a moral foundation upon someone. Okay, and I can't do that. That is unethical. A person that is Catholic can also do the same. A person that is Baptist, a person who is Muslim, Hindu, or what have you, Mormon, they can also have different programs and promote their religion as a part of the process. Okay. They can't do that in a professional environment, but they can do that in a religious environment, and that's okay for them. Okay, and so um, that is my perspective on that. And to me, there is a need to have church support. That it is a necessity, particularly in a lot of communities. And I think that there are a lot of people who have been helped due to having access to these programs. However, okay, it is not professional therapy. Brill X, shout out to Brill. Said, are you an LPC, LMSW, psychologist, or other? I'm an LPC. I'm a licensed professional counselor in the state of Texas. Okay. Terrell 5 stated, or V said, God first, but philosophy is helpful too. Great, great. And so, if you have that perspective, listen. I would never, as a therapist, if someone says that, hey, I am God first, I'm religious first, He's the first of my life, and so on. I will say, if that's your belief system, you have that belief system. But I'm not going to sit here and say that don't believe in God, believe in psychology. That no, I'm not. But I will present myself in a professional manner to develop a therapeutic environment that can be conducive to you having behavioral change. Okay, and so that is my perspective. And so from time to time, I will have clients that have these issues. Okay, they will have these issues. They will have religious issues. I've had clients that will ask me, "Can we talk about religious uh, themes and religious issues?" I reluctantly, depending on the situation, I will do it depending on the situation, and then I also caution them. I caution the client that I'm in no way going to um, push my own religious agenda. I will strictly keep it within the framework of psychological counseling theory. And I will approach it. If it doesn't work, it doesn't work, and we can move into a different direction. But I've had people who've had religious issues, and they came to counseling and they wanted to talk about those issues, and I tackled those issues, and we were successful. We were successful, but my presentation will continue and consistently be as a mental health professional, not as a religious figure who just so happens to have a master's degree and a license. That's a difference. And the religious overlap is huge in any community. Okay? Because when people are seeking help, they want help. Okay? When people are seeking help, they want help. And they want to go where they feel that it's a trusting environment. They don't want to feel inadequate. They don't want to feel like something is out of whack with them, or they're going to be seen a certain way. Okay, they don't want that. They want to feel comfortable. And so that is something that my field has, to me, done a bad job at. We've done a bad job in mental health of getting rid of fallacies and all these taboo related issues that prevent people from wanting to seek these therapies. We want to be so clinical until we are not relatable, and that's a problem. Brill states, are you a PV or TSU graduate? Because you talking some good stuff. I'm actually a Southern University graduate. I am from the SWAC. I am from an HBCU, but I grew up in Louisiana. I'm not originally from Houston. I'm originally from Louisiana, and I went to Southern University in Baton Rouge, Louisiana. Okay, so we must understand that. There are lines, there are rules and regulations, there is governance that is that of my field. Okay, religious organizations don't necessarily have those um, guidelines to follow, as I do. Rules, regulations, guidelines, ethics, um, and a lot of religious figures. They're unethical pastors, just like they're unethical therapists. They're unethical mental health professionals who cross the line. So um, that spills into all walks of life. However, if a religious figure causes harm to you, there's no recourse outside of you telling members and maybe trying to drive people away from the church. For me, there could be potential being sued, loss of licensure, suspending of licensure, a reprimand, higher liability insurance, damage to the practice. There's all types of accountability. So that's a difference. And so, um, and I've even had. I'm gonna say this, guys. I have had pastors who have come to me for therapy. Several. Most of the pastors, I mean, of course, they're usually black men, but because I am a black man, and there are those that have that consumer choice, and I would say probably 70 to 80% of black people who seek therapy prefer having a black therapist, man or woman. Okay, but I've had preachers who come to me for all types of issues, and they come in with the same type of issues that anybody else would. They come to me as it. I had one guy who was stressed out about starting a church. He had a brand new church he started in Houston. He was struggling with getting members, struggling with some programs that he was trying to do. He was trying to do 100 different things at one time. Uh, you know, he was basically stressing himself out, and he was overwhelmed. He was definitely overwhelmed, and and he came for therapy to learn how to cope with these psychosocial stresses, and we dealt with it, and I was able to help him over time. Okay, so there are many times, and I've heard people, oh, I don't need therapy, I just give it up to God. And sometimes people are expecting me to debate them with that. I'm not going to debate you on your belief. If you believe that you don't have I don't need therapy because I give everything up to God, you're free to believe that. And so, in many situations, and this has come to like the negatives of being, so in my regular life, when people know that, particularly when I was younger, and I think because black, people are more educated, or my environment's more educated, my community's more educated. When they found out you were in psychology or counseling, like, oh, you're trying to get in my head, or all these little, jokes and stuff. I don't get that as much. But people that in my normal daily life really don't ask me anything about counseling. They may ask me about me operating my business and so forth, and but they're not specific. Every now and then, I may have a family member or friend that may ask me a question. Uh, every now and then, okay. I found that to be quite different and an adjustment when you develop online relationships, because then what I found is that the people online are very different. They want to call and talk to you and want to constantly drill you and get every inch of information they can about mental health and so on. And so I find myself kind of, taking kind of, it's kind of different. But I understand that, the personalities and how people are online is totally different than those in your regular life. So I just take it as such. Okay. Um, but as I'm gonna say this: there is a necessity for church and strong church homes to provide support, and there is a great need, which is underutilized, as far as mental health professionals on both ends. The world is better with both of them, in my opinion. So I'm in no shape or form going to discourage anyone from seeking religious means to deal with their issues. But I will caution you, it is not therapy. It is not professional therapy. It can be somewhat therapeutic. Okay, and there are risks, and you can agree or disagree with those risks. If you're comfortable with going to a pastor for whatever reasons, that is, I'm not here to argue with you about what you should and should not do. You have consumer choice, but it has happened too often where I've dealt with people who have chose that route and they sought therapy as a last resort, and that's okay. That is okay. That is perfectly okay. That is the journey that you had to take. Unfortunately, um, it's not good to hear how people are psychologically affected in a negative way because of someone operating in such a way that caused more harm than healing. And to me, that is highly problematic. Highly problematic. Okay? Highly problematic. Okay? Um, Tyrell V of 5 says, what you eat also affects you mentally. Yes. Your diet can affect you mentally. Your diet can affect um, your energy levels, your cognitive functioning, your behavior. Yeah, diet, particularly with people who have mood and behavioral disorders. Your diet can have an effect. It can have an effect. Okay. So with that being said, guys, I just wanted to touch bases with you for a little bit to have a discussion with you on religion and mental health and how they overlap. If anybody has any other questions, I'd be happy to answer those questions, and then I'll end the live. Now, I'm not going to leave you. Give me someone asked the question. So RJ, shout out to RJ, said, "Brother, just got out of a 4-year relationship and moved into a new state. Where do I meet people? I'm 22, but don't like bars and clubs." Okay, now this is an instance where I would encourage you, if you are a religious person, to seek, friendships and a support group through a religious organization or church. Okay, I think a church is a great place to go when you are new to an area and to meet and find positive people. Now, that's if you're not a church person, I would say join a social organization. In your group that does things with the community. I mean, it all depends on the city you're in. Like if you were to come, let's say if you were moving to Houston and you're looking to meet people and you don't like bars, you don't like clubs. Okay, what I would say is I would encourage you to go to um, professional workshops. I would also say go to uh, any type of recreational um, um, any type of organization that's having some type of recreational event. Particularly, I would say go downtown to like Discovery Green. There's a place called the Post that people host all types of activities. There are all types of, depending on what your interests are. There is an app called Meetup. It's called Meetup, which is a like a social app where you can meet people, and they have all types of. They do happy hours together. They have like a 20 and something and up happy hour, or they do a 30 on up, 40 on up. Get-togethers where people get together and they exchange ideas and they have drinks and they eat together. There are all types of social groups. There's all types of recreational activities where there are a large group of people that are around to meet new people. Okay, so you can do those things. Those are your choices, but it all depends on the city you're in and your interests. Okay, so that would be my recommendation. Okay, for myself, when I moved to Houston, I had a lot of family here, so I interact with my family a lot. Um, you know, I interacted with people I worked with. Really, that's how I became sociable. But I did have relatives who linked me to professional organizations that did certain things, political organizations, churches and things like that, and that's how I got to know people. Okay. So with that being said, guys, I'm gonna go ahead and get out of here, guys. Just wanted to talk to you all to have that conversation on how religion and mental health overlap. Hope you all have a great day. Peace.